A program originally created to help monitor patients with chronic conditions is now doing the same for Mayo Clinic patients diagnosed with COVID-19.
And KTTC's Sarah Gannon shares more about how the program brings comfort to its patients. Sarah.
Well, good evening, Tom and Caitlin. The remote patient monitoring program is a form of telemedicine originally meant to support patients with complex chronic conditions from home. But since the coronavirus pandemic, this program is expanding to support patients fighting COVID-19.
Since late March, the remote patient monitoring program assisted in the care of 6,200 Mayo Clinic COVID-19 patients.
We do provide patients with a cellular-enabled tablet, as well as Bluetooth-enabled devices, and that would include a scale, a blood pressure cuff, that also allows us to get heart rate information, a temperature, pulse oximeter, glucometers and spirometers as needed.
A centralized team of nurses and physicians are able to remotely monitor patients while they quarantine at home. Mayo Clinic Dr. D.P. Goyle and his daughter contracted the virus and used the remote monitoring program as they recovered.
For both of us, it gave us this tremendous sense of comfort to know that there was someone watching our symptoms, our vital signs, and knowing when to escalate care.
The program is set up to ask COVID-related questions so health officials can better assess a patient's symptoms.
And to set up parameters for their vital sign monitoring such that we would get alerts anytime a patient had a drop in their oxygen saturations, or if they were experiencing a fever, and certainly if there were any concerning new or worsening symptoms.
And so I can tell you there was one day when my oxygen level did drop, and I reported that during my evening report, and I can tell you within 10 minutes I received a phone call from the remote patient monitoring group to verify my symptoms, but then to really assess the severity of my symptoms and make recommendations as to whether I need to be seen or whether I should just wait it out.
And right now, the program averages around 550 patients daily. At its peak in early July, the program averaged around 900 patients daily. Both doctors tell me a remote monitoring program like this will transform the future of healthcare by allowing for a higher level of healthcare at home. Reporting live in the studio, Sarah Gannon, KTTC News.
Sarah, thank you. The Byron Primary